the average American is on at least, one medication for chronic disease. And we think that that's normal, and it's not. You don't have to live like that. We've never been as a society more sick and unhealthy and anxious and depressed.
Yeah, just start off. Could you please introduce yourself, a little bit about how you got into like lifestyle medicine?
Mhm.
Um, and we'll just start there.
Sounds great. Well, first of all, thanks for the opportunity for this conversation. My name is Dr. Melissa Sundermann, and I'm a physician. I've been practicing for going on 30 years, for a long time. And I'm board certified in internal medicine, as well as what you said, lifestyle medicine. It's been a journey. It's been a fantastic journey throughout my career. And along the way, I've done internal medicine training. I've worked in offices. I've been a hospital-based physician. And I did additional training in integrative medicine, in mind-body medicine, and just always very curious about what is the best way to take care of my patients, but also take care of myself. And that goes well beyond pills and procedures in my mind. So that ultimately led me to discovering the field of lifestyle medicine. I discovered lifestyle medicine in about 2018 and became board certified through the American College of Lifestyle Medicine in 2019.
So how would you define lifestyle medicine and also integrative medicine, or what was the
Yeah,
other one?
integrative
Yeah.
medicine. Well, I think when we're talking about fields of lifestyle medicine, integrative medicine, mind-body medicine, functional medicine, if you think of a Venn diagram, there are so many overlaps with all of these fields of medicine. And we all come from, at least most of us come from a conventional medicine background. The thing that it really attracted me to lifestyle medicine is evidence-based. And it's evidence-based approaches to not only prevent chronic diseases and treat chronic diseases, but also reverse or possibly reverse chronic diseases. We now know that 80 to 90% of chronic diseases, and we talk about chronic diseases, we're talking about type 2 diabetes, high blood pressure, high cholesterol, chronic kidney disease, obesity. These are lifestyle driven for the most part. So approaching this from addressing first and foremost lifestyle behaviors is really how we're going to get to root cause of disease and start way upstream with disease prevention. And so the 6 pillars of lifestyle medicine, I'll go through those 6 pillars. And this is how we approach each of our patients. It's how I live my life, is that we, first of all, first pillar, in no particular level of importance, because these are all really important, is looking at food as medicine. And just as Hippocrates said many centuries ago, let food be thy medicine and medicine be thy food. And truly, what is on the end of your fork either helps prevent disease or could be contributing to disease. So really looking at food as medicine. And through the American College of Lifestyle Medicine, we do advocate for a plant forward, or you can call it plant slant dietary pattern. So a dietary pattern that is rich in fruits and vegetables and beans and whole grains and nuts and seeds. We often like to say, eat the rainbow, but that is not M&Ms and Skittles, right? That's all these beautiful, colorful whole foods that are rich in antioxidants and phytonutrients. The second pillar, movement, daily physical activity. And when I'm counseling my patients, I tend to stay away from the term exercise because sometimes people get turned off by that word. They think that exercise means that you have to go to a gym and you have to have big muscles. Whereas if we just reframe that as moving your body, you can move your body in a bazillion ways. In fact, walking is one of the best forms of movement. And walking for most people is something that is attainable. So finding ways that you can move your body that brings joy. Some people like to dance. Some people like to play pickleball. Some people like to swim or go bird watching. So trying to get daily physical activity. The third pillar is going to be sleep. And sleep truly is a superpower. I went through residency back in the 90s when we worked like 36-hour shifts. And I thought, oh, sleep, I don't need sleep. And I was so wrong. So our brain, our bodies get recharged when we sleep. Our brains are incredibly active. There's actually something called the glymphatic system that is activated when we sleep, which helps to get rid of tangled toxins and proteins and keep our brains and our bodies healthy. The fourth pillar is going to be the avoidance of risky substances and risky behaviors and substances that do not serve us. So that could be things like tobacco, excessive alcohol, excessive drug use, or just even behaviors that don't serve you. Maybe that's compulsive shopping, compulsive gambling, anything that does not serve us. The fifth pillar is stress management. And we all have stress in our life every single day. And I don't have a pill to take that away. But what we do have are tools to best handle and manage our stress. So whether that's yoga or deep breathing or meditation or taking a walk outside or journaling, these are all tools that we can employ to help manage daily stress. And then the sixth official pillar of lifestyle medicine is positive social connection. And I think we all experienced this during COVID and during lockdown, where we were told to stay away from all of our friends and family and don't hug anyone. And after a year and a half, I know I felt this huge void, right? And that's because we as human beings, we need social connection. It doesn't mean you have to be an extrovert. It just means that you want to connect with maybe a family member or a friend or a pet or a place of worship. Use a place of belonging. And we now have more and more data to support social isolation and loneliness actually can increase our risk of mortality and dementia. So finding your tribe and being together. So those were the 6 official pillars of lifestyle medicine. Now, what I am a huge advocate for, and maybe why you brought me to this conversation, is I feel like there should be a 7th pillar of lifestyle medicine, and that is daily exposure to nature and fresh air. I am also known as Dr. Outdoors, which is absolutely serendipitous and perfect because my medical degree is a DO, Doctor of Osteopathic Medicine. So many years I have been practicing proudly as a DO, as a Doctor of Osteopathic Medicine, and now I can say that that DO officially stands for Dr. Outdoors. I gave a talk at the American College of Lifestyle Medicine annual conference in 2022 about therapeutic benefits of nature, and I had such a positive feedback from this talk that I had many members in the American College of Lifestyle Medicine that wanted to learn more. And in 2023, I became the founding chair of the first ever Nature as Medicine Committee for the American College of Lifestyle Medicine. We've been around for 2 years now. We are growing exponentially every month, and we have members from all over the world. And we meet via Zoom every month. And so we bring in speakers from all over the world as well. So we've had people such as Florence Williams, who wrote The Nature Fix. We've had Wallace J. Nichols, who wrote Blue Mind. We've had just incredible speakers. We just had Louis Schwartzberg, who is a producer and cinematographer for Fantastic Fungi. So it has been an absolutely joy of mine and so educational to bring this knowledge and this advocacy work globally under the American College of Lifestyle Medicine and really grow this to clinicians, but also just beyond that. So we can educate our clinicians so that when our clinicians are seeing patients or clients, we can educate everyone about this.
Could you define osteopathic medicine for people who don't know what it is?
Absolutely. So when you go to medical school, there's actually, they're so very similar nowadays. There are allopathic and osteopathic medical schools. And I went to Michigan State University in the state of Michigan, of course, and they actually have both an allopathic MD program and an osteopathic DO program. We took all of the same classes together. So we take DOs and MDs take all of the core science, the same ones, but then DOs are also trained in something called osteopathic manual medicine. It's a hands-on approach. So I would say that as a DO, I was maybe trained a little bit more integratively thinking, so thinking about the body as a whole. And the reality is nowadays, if you went to a doctor, you probably would not know a difference because we do the similar residencies. We practice, when I've ever been in practice in group practices, we are DOs and MDs. We practice very much the same. I would just say that DOs have an extra tool in their tool bag.
Have you always been really nature and nature as a healing method, or is this something you've discovered along the way, or how did you get into like integrative healing?
Yeah, I think that the answer is yes. I've always been connected to nature. I just never until recently articulated that. I just knew that I grew up in the 70s, right? So we spent so much time outdoors. I had a banana seat bike. I would ride my bike with my friends all over the neighborhoods. We built tree forts. We were digging for worms. We were catching fireflies. We were picking up caterpillars. So I just grew up like that, right? We'd pitch tents in the backyards. I was just always connected with nature, and getting older and in college and in medical school when I was feeling really stressed out, the thing that would ground me and bring me back and save me was going outdoors. And I'm an endurance, I'll say an endurance athlete. I was actually a ballet dancer growing up, but then I started mountain biking and running and hiking in college, and absolutely loved it. So when I was feeling really stressed, still to this day, I get outdoors and I go for a walk, or I get outdoors and get on my bike, or I get outdoors and take my dog for a walk. So it's something that has been so therapeutic and so needed, that when I started really realizing that connection of, gosh, when I'm really upset, when I'm really stressed, what makes me feel the best? And it's going outdoors, right? Whether it's a sunny day, whether it's a snowy day, whether it's a rainy day, there's just such beauty and simplicity and connection where I just feel myself, right? And I've often said that in good times and in bad times, like, nature's always there for me. I've had some of the best days of my life being out in nature. And on the worst days of my life, I've gone to nature to be saved. And when I started thinking about this as a physician and looking at my own life, my own well-being, it's like a light bulb went off and said, nature is so important to you and such a key component to your own wellness. Why don't you start digging, no pun intended, into the research to see, is there scientific evidence behind this? And as you know, absolutely, there's scientific evidence that supports the healing benefits of nature. And I think this is so important nowadays for adults, and really important for youth. Kids growing up today are not on their banana seat bikes, riding around their neighborhoods, looking for, playing capture the flag and building tree forts. So many kids today are tied to screens, and it's just a different world. So I think it's so important that we start talking about this. And the EPA did a study several years ago asking Americans how much time they spend outdoors. And the average American only spends about 7% of their day outdoors. So the rest of the time is spent inside homes, workplaces, schools, stores, inside buildings. And then about 6% of the day is spent inside automobiles or public transportation. So only about 7% of our day is spent outdoors. And we're just, we're on Zoom calls. And I just want to continue to use my voice and my passion to engage, to empower, to educate individuals that really, you don't have to live outdoors, and really that nature dose to get those benefits of nature is about 20 minutes per day. For many physicians and beyond physicians, of clinicians, anyone who is working with individuals and educators, and to prescribe, to educate, to encourage people to spend at least 20 minutes outside every day.
What do you say to people who feel like they can't find the time, or even like struggle?
Yeah.
Or like, oh, there's no parks near me, or
That's a great question. And there are barriers to going outdoors. I'm lucky enough, I live on 2 acres in the woods. Like, I literally open my door and it's right there. But there might be people who live in big cities. There might be people who live in unsafe areas. There might be people that have disabilities that can't just get outdoors, or have, feeling very anxious or depressed, and they can't get outdoors, or they're sick. So what are other options? So first off, if you live in a big city and you say, I don't have woods in my backyard, like Dr. Outdoors, what can you do? I was just in Boston last week, ran the Boston Marathon, and I went to the Boston Garden, the Boston Common, New York City, Central Park. So finding maybe a park in a big urban city, and even a tree-lined canopy street. Barcelona is doing an incredible job about planting thousands of trees in this big city. It helps to bring down the temperature of the city, but we get all those benefits of inhaling those phytoncides. So just finding a tree-lined canopy, or perhaps going to a schoolyard. If you have a school that's nearby, there's hopefully a playground there that you could go there. So those are some options if you live in an urban area. What if you just physically can't get outdoors? In LA, with the forest fires recently, like I said, unsafe areas, you have a disability. Well, then we're looking at virtual nature. And there's some really great studies that support just listening to bird song. So maybe you could open your window and listen for birds. Or if the air quality is bad, just going to a YouTube and listening to birdsong. One study looked at listening to birdsong versus loud urban traffic sounds, and they found that people who listened to birdsong for those 6-minute sound bites had lower feelings of anxiety and lower feelings of paranoia just by listening. And what about just looking at nature? So perhaps you can't open your windows and you don't have access to a computer or something to listen to. You could just be looking at nature and actually get some benefits. A study that looked at this, it was back in the 80s, and it was looking at hospitalized patients. And it was 46 patients that had just had their gallbladder out. So post-cholecystectomy. Each of these patients had their own hospital room, private room, and they all had a window in their room. Half the patients had a window that faced some form of nature, whether it was a courtyard, maybe a tree, maybe a flower bed. The other half had a window, but their window was facing a brick wall. And what they found were the people who were viewing nature, those patients, required less pain medication, had fewer negative evaluative comments from the nurses, meaning that they behaved better, and had shorter hospital stays. They recovered quickly just from viewing nature. And now we're starting to get some studies looking at virtual reality. And this could be really good for people in nursing homes or assisted living, that just projecting virtual nature on windows or walls could be of benefit. And there was a great study that was like a crossover study of having subjects in a waiting room. And the first waiting room was just all white walls. And then they went and did a task. And then the second time they came back, the walls, instead of being all white, had virtual nature scenes that were playing. And what they found were the people, after they were in that virtual reality nature, they had higher heart rate variability and they felt more relaxed, more productive. So those are some really good things to think about. It'd be great if you can get outdoors. You don't have to go into a forest. Just being around any blue space or green space. You can do urban. You can work in urban gardens, get a plot of land. If you can't get outdoors, then listening to nature, viewing nature, maybe some virtual reality.
I do find it very fascinating that even virtually you're seeing similar effects. I wonder if that's why people are so interested in like ASMR, some of these more like nature kind of soothing type videos.
Yeah, absolutely. And this producer, Louis Schwartzberg, who was one of our guest speakers, he has a whole website called Moving Art. His cinematography, he does time-lapse cinematography. So he'll set his camera up there and it just films and he puts it together. It literally is breathtaking. Like I don't know if you know, in Las Vegas, they have the Sphere and they project images. And so he's projected his nature images on there. And it's nature, whether it's reality, you're in there or you're viewing it. It really is one of the places where we experience awe, right? Where you feel this connection of something bigger than you. And it's something that brings us all together. I think anyone, no matter where you live in the world, if you see a beautiful sunrise or a beautiful sunset or a rainbow, we all are just captivated by that, right? And feel like it's a gift. So just connecting to who we are, and the concept of biophilia, which was, most of us know about it, biophilia, by E.O. Wilson, who wrote about biophilia. And biophilia is the innate connection of all things living. So I think we sometimes forget that we as humans are nature, right? So we are made of carbon, just like the plant, just like our animals, just like everything that surrounds us that's living. And it is programmed in our DNA to connect. That's why we feel so good when we're outdoors and we can connect with all things living. So biophilia, and coming back to biophilia and who we truly are.
What do you think we're doing to ourselves as a collective and individuals by building walls against it? Like, there's still kind of a movement away from nature. What are we doing to ourselves by going in that direction?
Well, so much, not just nature, but so much of our lifestyles are, we've never been as a society more sick and unhealthy and anxious and depressed. I've been in practice long enough to see this shift, right? I mean, the average American is on at least, one medication for chronic disease. And we think that that's normal, and it's not. You don't have to live like that. So I think our society, we're never been more sedentary. Sitting is the new smoking. Like, people don't really smoke anymore, right? But growing up, everyone smoked around. My parents smoked and everything like that. But nowadays, we just don't see that as much because we've had really great public service announcements about how tobacco is related to cancer and increased risk. I would love to see more public service announcements and not even announcements, but programming of, we know that there's highly processed foods and are really contributing to our morbidity and mortality. We know that sedentary behavior is. We know that stress, anxiety, and social isolation and lack of nature, I feel like, is right up there. And I think when we're looking at planetary health and what's happening to our planet, the more that we can connect to nature and see the beauty in nature, the more that we're going to care about our planet and take care of our planet. So I think there's there's so much that needs to be done. I see lifestyle medicine, the field of lifestyle medicine, as being the path to elevating the health and wellness of all human beings. Lifestyle medicine is very much a growing field. We have probably 6,000 plus physicians board certified in lifestyle medicine now. Sounds like a big number, but it's such a small number compared to all of the physicians in the world. So we are collectively very passionate. We are collegial. We all work together. We're collaborative, and we really want to shift the paradigm of the healthcare system from a sick care system to a well care system. When we talk about, longevity is a big buzzword right now, and that's one thing, to live long. We want to live forever. I don't want to live in illness. I don't want the last 10 or 20 years of my life to be bedridden. So really, if we're talking about lifespan, extending lifespan, what we really need to focus on is extending well span or health span. And how do we go about doing that? And I firmly believe that by educating and advocating and incentivizing physicians to take care of people, our patients, in this way of, let's talk about the foods that you're eating. Let's educate about that. How are you moving your body? How are you sleeping? How are you managing stress? Are you connecting with others? Are you getting outdoors every day? So these are the prescriptions that really we need to be prescribing, right? So when I give talks about nature, and I talk to lots and lots of physician groups, and I give webinars all the time to lay people. And I say, raise of hands, either in person or virtually, who's, been outdoors today? And if you're a clinician, who's prescribing nature? And I get some hands. When I ask who's prescribing nature, maybe just a few. And then I say, by the end of this talk, I want everyone's hands raised to think about prescribing this. If you're a clinician and you prescribe medications every day, these lifestyle behaviors are more important. Now, as a physician, yes, I still prescribe medications, blood pressure medication, cholesterol medications, medications to support mood. And I also want to prescribe all those other lifestyle prescriptions as well.
Is there one specific sort of underrated biohack that you've found to help yourself or your clients, or maybe something that hasn't been spoken about quite as much that you see as like a big improvement or a great lifestyle change?
Yeah. Well, I think the whole biohacking, in general, I think there's no easy button or quick fix to anything, right? All of those quick fixes, or I just take this pill and I'll be better. A lot of things in life that feel so good in the moment don't serve us well long term, right? So I think that first and foremost, there needs to be a foundation of healthy lifestyles, healthy dietary patterns, healthy movement, healthy sleep, managing stress, social connection, avoiding risky substances, getting outdoors. Foundationally, those need to be there. Having perspective, having a purpose, all of those. Now, in addition, on top of that, once you have that foundation, I think some of these things could augment or help. You mentioned early morning sunlight, and I think that would be one of my favorites, because I think that a lot of times won't cost you anything, any money. Some of these biohacking can be really, they leave out a large percentage of the population, right? So some of these supplements can be very expensive. Getting a home unit for a red light can be very expensive. Cold plunge, I live near a lake. I could go just jump in there, but people who are getting cold plunges or home saunas, these can be cost prohibitive. Getting outdoors, before the hour of 9 a.m. or 10 a.m. without wearing glasses, and just getting that early morning sunlight into your retinas can help to align your circadian rhythm. We are biologically meant to have a circadian rhythm and be up when the sun is up and settle down when the sun is down. It can help to boost our serotonin level. It helps to align our melatonin secretion, helps to align our cortisol. And I tell people, like, I would love it if you're moving your body and being outdoors in the morning, but you don't necessarily have to do that. So perhaps going outside to journal, or having your cup of tea or your coffee outdoors, or meeting up for a friend and just having a conversation outdoors. I think that is going to be number one on my list of, if we want to call biohacking. But it's just really what our ancestors did, right? They got up early because you needed to work the farm. You needed to go find some food. You needed to, go down and get water. Like, that's just, I think, how we're programmed. We're not programmed to get up and, go straight to a computer and get straight on our phones. We're programmed to get outdoors and let our brains and our bodies know that it is daylight and reap the benefits of that.
Is there anything you'd like to talk about that is really on your mind right now? Anything you're really excited about?
Yeah. I think the thing that I am so excited about is, like I said, I've been practicing medicine for 30 years. I come from a traditional, conventional background in medicine, and I've always believed in whole person care. And that means encompassing everything. And that's why I did additional training in mind, body medicine and integrative medicine and some functional medicine and lifestyle medicine. And what is so exciting to me is the consumer is interested in this now, right? Dan Buettner's, Blue Zones and his docuseries Live to 100, people are really into. You mentioned Huberman's podcast and Dr. Peter Attia, his podcast. So people are reading books or listening to podcasts or watching docuseries, and they're like, whoa, I want to learn more. So as a physician who has been advocating for this, who has been, I don't want to say preaching, I don't like the preaching, but who has been really talking about this, now we have people who are interested. So I feel that I am riding this wonderful wave of opportunity. And I recently celebrated my 55th birthday. So when many people are thinking about slowing down, end of career, I feel like I am just really getting started. My Dr. Outdoors brand is really taking off. I've trademarked it. I'm going to have a book coming out, probably Q4, Dr. Outdoors Guide to Nature and Lifestyle Medicine. And I have some other pipe dreams and moonshots in the works. And I've really been able to connect globally. So there's an organization called the Global Wellness Institute, and they wanted to have a lifestyle medicine initiative. So I was appointed as the chair of the Lifestyle Medicine Initiative for the Global Wellness Institute. So we're seeing this tremendous growth. And I think it's just going to keep going up from here. And I love just talking to people and educating them. I do a lot of webinars for people, and I'm flying to Portugal later this week to speak at a big longevity conference talking about nature, right? So it's really been an amazing journey that I feel I'm showing up authentically as myself, and I found my voice, and that feels really amazing, just to align my personal belief system with my professional belief system and have a blast along the way.
One final question before we wrap everything up. I'm curious how lifestyle medicine and this approach has affected you personally and elevated your life.
I will say, so I have two amazing kids who are now in their 20s, and I have an amazing husband, and I have dogs. I'm family. These are all tremendous gifts in my life. And you know what? Finding lifestyle medicine has been a huge gift in my life as well. To me, discovering that felt like coming home, because I always felt like this outlier practicing medicine because I was talking about the wellness stuff, right? And I didn't quite fit in. I felt like this unicorn. And becoming board certified in lifestyle medicine and finding my people, like I said, finding the courage to put myself out there has been such a gift to me. And I have the best colleagues in the world. And it's wonderful. I can't say more about it. And I think you'll be hearing more and more about lifestyle medicine in the American College of Lifestyle Medicine as we continue to grow and flourish. And get the word out there.
Great. Well, it's so nice meeting you.
Yeah.
Oh, doctor.
Yeah.
Thanks for speaking with us. What are the other platforms that I can...
Yeah, so I'm on Instagram. I've got two. I'm
Okay.
at the Doctor Outdoors.
Mm-hmm.
My other handle is at Motivator Melissa.
Okay.
And then I believe, because he does this for me, my TikTok and YouTube are both at or the Doctor Outdoors, and X is also the Doctor Outdoors.
Okay. Perfect. All right. Well, thank you so much for your time.
Yeah, thanks for your flexibility of me. Like, I can do it, I can't do it. So we got to do it.
Crazy. How was the Boston rest?
Oh, it was incredible. It's my 12th Boston and my 23-year-old daughter's first. And so we wore matching outfits and we ran the whole thing together across the finish line holding hands. So it was everything that we ever dreamed about. And what was really great is we had like matching sunglasses and we had French braids, and the whole time people were like, look at the twins, look at the twin sisters. And I was like, this is the best ever.
Wow. Yes, there you go.
Yeah.
Lifestyle medicine at its finest.
I know.